So opioids spark HIV outbreak in Massachusetts, despite the robust local health surge in new HIV cases among people who use intravenous. And so here we have Massachusetts. Opioids have sparked Lowell, Massachusetts. For many public health experts, Massachusetts' near universal health insurance coverage makes it the gold standard for access to care. So it's the place in the country where you'd expect to find a spike in HIV cases alarming enough to pique the interest of the federal government. So this has really, really gotten so out of control that HIV is involved in this. But despite the robust local health systems, the industrial cities of Lowell population, one in Lawrence population is 80,000, just 9 miles apart from one another near the New Hampshire border, have both seen a surge in new HIV cases among people who use intravenous drugs. Between 2015 and 2018, there were 129 new HIV cases linked to the drugs use in the two cities, according to the preliminary results from a joint investigation by Massachusetts Department of Health, Public Health, and the U.S. Center for Disease Control and Prevention. By comparison, in 2012 to 2014, an average of just 41 cases of HIV was linked to the injections of drugs use that were diagnosed per year in the entire state of Massachusetts. And so now it has grown and is starting to spike out of control. So the report found that the major factors that contributed to the outbreak, many of them outside of the reach of traditional healthcare, are small-scale versions of nationwide trends. Most notably, local stakeholders told investigators that Lawrence had a local illegal fentanyl manufacturing operation, which made the synthetic opioid an efficient vector for HIV because its short high leads to more frequent injections, both pervasive and cheap. Meanwhile, rampant homelessness disrupts treatment for those most at risk. And even though community leaders in Lawrence and Lowell pushed for clean needle exchanges, a known method for stopping infectious disease spread, they only did so after the outbreak began. As fentanyl spreads across the U.S., drug use patterns evolve. Other areas of the country with the same constellation of risk factors should take note. This tells us we cannot rest our laurels on our laurels, said Thomas Stopka. So, the infectious disease epidemiologist and assistant professor at Tufts University School of Medicine. There are potentially other communities that are at great risk as well. So HIV can and is raising its head again in places where risks align. So if the outbreak had happened in a less aggressively surveilled state, Massachusetts has one of the best HIV hepatitis C surveillance systems in the county or in the country, actually. It likely would have been much worse, according to Amy Nunn, executive director of Rhode Island Public Health Institute. So this may be forecasting what could conceivably happen around the country. Said Nunn, who was not involved in the investigation. So tracing an outbreak, staff at the Greater Lawrence Family Health Center were used to seeing one of the HIV cases each month. So a fraction of which were drug related. Some months they didn't even see any new cases at all. But in 2016, of course, that changed. The center diagnosed 5 new cases in June and in July. It didn't slow down from there. By the end of the year, the state's health department had gotten involved and had recorded 23 new HIV diagnosed cases among people injecting drugs into their body in the 2 cities. So 2017, the diagnosed had more than doubled to 52 new cases. So prior to the outbreak, HIV had been declining among all the risk groups in Massachusetts, and nationally, only 9% of the HIV diagnoses in 2016 were linked to injections of drug use, according to the CDC National HIV Surveillance System. So HIV can and is rising its head again in places where risks were aligned. Thomas Stopka, Tufts University School of Medicine. So the uptick of 2016 to 2017 might not seem dramatic on paper, but it's well outside the norm. Concerned state health department staff called in backup from the federal government, including a rapid response team of epidemic intelligence service officers, disease detectives from the CDC, who swoop in and behest of local authorities to help investigate urgent public health problems. So over the course of 5 weeks investigation this spring, this joint local federal task force interviewed law enforcement, homeless services, members of local government, and people who injected drugs. And other task force members worked in the laboratory collecting specimens and doing RNA virus sequencing to trace the movement of the virus through the community. So the team presented their initial findings July 24th. Came up with this. The most striking finding was the sheer number of cases, said Stopka, who attended the meeting. Of the 129 newly diagnosed cases, 67 were diagnosed in 2018 alone. So it was substantially higher than that was seen in the prior years prior, Stopka said. So 129 figure definitely caught a lot of folks' attention and really spoke to the great need in terms of the response. So the majority of cases were among white men between the ages of 20 and 39, and 90% of them had also been infected with hepatitis C at some point in their lives. Hepatitis C infection tends to correlate strongly with injection of drugs. So it's a significant outbreak, said Dr. Charles Alpern, a CDC officer who investigated the outbreak. Still, he stressed that it's important to consider local context. Why here? Why now? He asked. That was very much one of the things we were looking into. What makes Lawrence and Laurel different? It's spreading around like wildfire. And so you see the needle pictured here, where drug users are dropping needles wherever they shoot up. And people with the biggest risk of HIV factor, like men who have sex with other males, might get tested 2 and 3 times per year. But Dr. Alissi Worcel, an attending infectious disease physician at Tufts Medical Center, said that until the current outbreak hit, young people injecting drugs didn't automatically trigger HIV testing for local doctors, in part because they hadn't seen cases for 15 or 20 years. Indeed, investigators found that the local HIV testing had decreased in recent years and wasn't routinely being offered in local emergency rooms or jails. Diagnosing young men in the hospital with HIV A man who had been tested for the disease only 6 months prior, James Rossell, perspective. So you need to test more than you think you need to do, she said. So Rossell pointed to the research letter published in JAMA, which is JAMA, in June, which found that 12% of the people who injected drugs were unaware that they even had HIV. So among the unaware HIV positive group, 77% reported not having had HIV test in the past year. Of those who were tested, 45% of them had visited the doctor but were never offered an HIV test. So the continued stigma of HIV also makes people who use drugs, an already stigmatized group, shy away from testing for HIV. So we all use, Mark says, a tan 29-year-old with tattoos and a thick Boston accent told Huffington Post in May. So we all know that the other one has it, and we don't tell each other. So people will lie right in your face about having it, and it's spreading like wildfire. And so Mark, who preferred to go by his first name, was diagnosed with HIV 4 months earlier after a girl he was dating revealed her HIV positive status to him when she became pregnant. So people think that you can look at somebody and tell what somebody has, he said, squinting into the sun as he stood in a small square near the Merrimack River in Lowell. I don't work like that. Mark contemplated suicide when he learned that he had HIV and he was positive. He said, an HIV diagnosis is a life-changing thing, but experts say that once the initial shock wears off, many people with addictions see their diagnosis as a wake-up call and seek treatment. I'm healthy, I feel good, I stopped using, I don't do heroin anymore, and I don't do any cocaine no more. So he says that he smokes weed and he drinks. He said, but that's it. But I'm still screwed for the rest of my life. That's what the guy was saying, because he still is HIV positive. So he said he also caught hepatitis from using needles. Now, this was a guy named Wade. It's horrible. That's why I don't inject no more. So both men felt frustrated by their peers' refusal to get tested, and many people would rather live with an undiagnosed infectious disease and risk passing it on to others than suffer the stigma of the diagnosis, they explained. So I was undetectable in 3 months. And so the 3 months, even if he got tested, it didn't show up. So I can have kids and everything, and I don't have to worry about them getting it. But it's still hard to find somebody, Mark said. People are like, oh, you're dirty. I don't want nothing to do with you. It really hurts. So they'd rather nobody know and keep spreading the disease around, he said. Cheap fentanyl and a crisis of homelessness. So here you see people that will probably do drugs under these freeways and under these abandoned areas where homeless people frequent. So fentanyl is a potent synthetic opioid that surpassed the deadlines of prescription opioids, contributing to nearly 20,000 deaths in 2016. And it is particularly prevalent in the New England area. And Massachusetts has one of the highest synthetic opioid-related deaths rates in the nation, third only to New Hampshire and West Virginia. While Lawrence reportedly had its own production hub, cheap white powder fentanyl is typically imported from China or Mexico and used to cut more expensive drugs like heroin and cocaine to improve profit margins and to trigger more intense and fast onset highs. So for now, fentanyl-laced heroin is more prevalent east of the Mississippi because it closely resembles the white powder heroin that was widely used in the region. So it's harder to mix fentanyl into a black tar heroin commonly found in west of Mississippi. So fentanyl's short half-life, means that the drug kicks in quickly and fades faster than a heroin high. To stave off withdrawal, people who use fentanyl might have to inject up to 8 times a day, while people who inject heroin would typically inject 2 to 4 times daily to avoid withdrawal symptoms. Injecting more frequently means greater risk and temptation to share needles if clean ones aren't available through programs like needle exchanges. So Lawrence reported that illegal manufacturing operation made the drug so cheap to buy that many people in the area have turned to injecting pure fentanyl altogether, which is a death ticket. To give a sense of the scale, local production makes buying illicit fentanyl 3 times cheaper in Lawrence than in its Lowell, and 5 times cheaper than buying fentanyl 30 miles to the north in the Manchester and New Hampshire areas. So, complicating matters is the high homelessness population in Lawrence and Laurel. Homelessness in Laurel nearly doubled between 2005 to 2017, according to the Department of Housing and Urban Development. HUD, which is Housing Urban Development, coined as HUD, did not report city-specific data for Lawrence, but roughly 700 of Massachusetts' 17,565 homeless individuals reside there. The CDC investigators' interviews confirmed what's visually evident by walking along the city's Merrimack. So Merrimack is a river which is dotted with deserted sleeping bags and old clothes and liquor bottles and occasionally used needles from people who are addicted to drugs. So everyone the investigators interviewed who reported injecting drugs had been homeless at some point during the previous year. And so this is a big problem that has plagued this area so bad that these people are really suffering with this. Okay, so we're seeing some of the clips of this area. So everyone the investigators interviewed who reported injecting drugs had been homeless at some point in the previous year. So homelessness breaks up consistency and it makes sustaining care and continuity of care harder. So Alperin said that, noting that the incarceration also highlighted in the report similarly has the potential to disrupt HIV care and treatment. So for Judy Lethbridge, client at Lowell Community Health Center, many of whom were unstably housed, finding an affordable place to live is a pressing daily concern. Even with a housing voucher, and rents in Lowell and Massachusetts at large aren't affordable, explained Lethbridge, the center's quality coordinator. So often the vouchers that are available fall short of the rent prices. So many times the only neighborhoods that people can use the vouchers in and can afford are in the core of where the local drugs usually happen. And so the structural instability makes keeping up with the health services like addiction or HIV treatment nearly impossible. So it's particularly difficult to keep housing if you are using. And it's difficult to take your medication if you're homeless, Lethbridge said. It's all intertwined with the drug use. A city without a needle exchange is setting up for a disaster. So Massachusetts is one of the few states that provides state funding for syringe services programs, but neither Lawrence nor Laurel or Lowell had a state authorized exchange before the outbreak occurred. So the ad hoc exchanges that did exist were not robust enough to counter the effects of fentanyl use. So they may have had underground syringe service programs, but they did not have supported funding and funded fully staffed syringe service programs. So Stopka said this. That's true about many small cities throughout the country. So that's setting up a situation for disaster. So needle exchange programs are a positive step to reducing spreads of infectious diseases from the public's health point of view. But Mark stressed that the people who use drugs often feel a sense of urgency to get high immediately, especially if they're going to go through a withdrawal period and the symptoms of that withdrawal. Increasing clean needle exchange hours would only make so much of the difference in the situation. So when you're addicted, Mark explained, you're willing to suspend disbelief momentarily about a partner, a friend's health status. And so people just don't care anymore, he said. And when it comes down to it, if you've got a bag in your hand and somebody's next to you and they got dirty needles, you're not going to run and find a clean needle. And so look at this area, how it looks, where people shoot up and where homeless people, encamp. So still there are advantages beyond the equipment itself. So Stopka stressed that the syringe exchange provides a valuable link between doctors and people who use drugs. So for many people in the throes of addiction, this is their only contact with public health services and healthcare services, he said. So it's essential for these programs to be in place. So the state health department authorized Lawrence's formal needle exchange after the 2016 uptick of HIV cases. So Lowell voted to authorize its own exchange in June, but neither exchange was fully established at the onset of this HIV outbreak. So even now, there's a huge unmet need for clean needles, according to the report. So the hours of the current exchanges are limited, and more syringes need to be distributed to discourage people from reusing and resharing needles. That's like the rest of the country, where geographic, financial, and social barriers to opening and running exchange programs mean that far fewer people have access to clean needles than need them. The rest of the country needs to prepare. So the case of Lawrence and Lowell isn't the first large-scale drug-related HIV outbreak in recent years. The distinction goes to Scott County, Indiana, and where the HIV outbreak ballooned to more than 200 newly diagnosed cases in 2015. The culprit there was Opana, a prescription opioid that, like fentanyl, has a shorter half-life than heroin. In response, the CDC released a list of 220 countries, or counties, most vulnerable to the HIV outbreak due to the drug use in 2016. So the bulk of the hotspots were clustered in Kentucky, Tennessee, West Virginia, and Ohio. So no counties in Massachusetts made the CDC list, suggesting a myopic focus on rural risk factors at the time. So Scott County shook everybody pretty hard, said John Zibel, a senior public health analyst at the nonprofit research group RTI International, who worked on the CDC's vulnerable counties assessment. And so when it comes down to it, if you got a bag in your hand and somebody's next to you and got dirty needles, you're not going to go run and find clean ones. Mark, a Lowell resident who stopped injecting heroin after contracting HIV from a partner, Zabel, said that some of the indicators the group used to determine which counties were vulnerable, such as race, may have skewed the residents towards capturing rural areas with some vulnerabilities as Scott County and overlooking more urban localities. During the eclipse of all of the other urban areas that were also at risk for HIV outbreak, he said, Even at the time, Dr. Alfred de Maria, a former Massachusetts state epidemiologist, thought focusing on rural counties would miss a swath of the rich suburban and urban areas. They were all places that looked like Appalachia, said De Maria, who helped lead the investigation this spring. So there are big issues in Lawrence and Lowell and huge disparities, but they're not exactly rural. Zabel thinks it's time for a follow-up assessment that looks specifically at vulnerable urban cities. So we tend to think it's just rural areas that have limited access to syringe exchange programs, said Regina Lobel, who worked with the White House Office of National Drug Control Policy during the Obama administration. So LaBelle noted that Lawrence and Lowell's nascent syringe programs were reactions to an uptick of HIV cases. Fortunately, we tend to solve yesterday's problem rather than looking at how to prevent outbreaks such as this, she said. Now there's an urgency to open it, but unfortunately, it's too late for those who have been infected. Lack of access, sterile syringes in paramount, Stopka said. If people are injecting drugs in the communities that don't have reliable needle exchange programs or pharmacies selling clean needles, they'll likely be reusing and sharing syringes. And the groundwork is then laid for an outbreak. At present, 15 states, primarily in the South and Western US, have bans in place against needle exchanges. So if it can happen in Massachusetts, which has all the support in the world and all the services in the world, it can happen anywhere, Lethbridge said. So this is a big problem, and people really need help in terms of these areas. And it doesn't look like it'll just be in these areas. It spread to the other areas is what they're saying. And there's an uptick in HIV, and I've been saying this in previous videos, despite what people think out there. They think, taking all of this medicine is going to, prolong your life, and it may make people live longer. But I also discovered that there's a new strain of HIV that is coming out that is making copies of itself and is becoming a little more resistant to these medications. And so we're going to be right back where we were in the 80s and 90s, or late 80s, rather, somewhere in the mid to late 80s, when there was that outbreak of HIV that just straight away went from HIV to AIDS. And so this is pretty much the story. It's really sad that this is happening all over again, but I knew it would, and it just doesn't seem like it's going to end, because it's a lot of problems involved in this, especially resulting from the opioid and the fentanyl and the drugs that are coming from. And I have to be honest, and I'm not trying to be offending anyone, but they did say in here that the drugs come from China and they come from Mexico. And in China, what I heard is that it's not illegal to send those drugs when the person is there doing it. And oftentimes when they try to track who sent the drugs, when the drugs try to come in through the airport, they have all these dogs and all these people checking the bags and things. They have all these genius ways of trying to send it over here. And they confiscate a lot more of it, fentanyl and all these drugs. And what happens is that when they try to trace or track who sends it, they're untraceable. They never find who's done it. And they can't be penalized in their own country, in China. Now, I don't know about Mexico. Doesn't seem like they really can track who those people are either. It's a huge problem, and it's gotten far out of control, and people are dying right here in America. So it's really getting really pretty serious and pervasive anytime that HIV is involved in all of this now. Thoughts, comments, feedback? Thanks for listening.